I hope everybody joins in early so that I can start that nitric acid case. A very interesting case which we cured with the 1 dose of nitric acid. I'll discuss that case, but before that, I hope everybody joins in early. Before that, let me tell you something that in homeopathy, welcome Dr. Vishal. Before that, let me tell you that in homeopathy, it is very important to understand in acute cases, especially which symptom to take for prescription and which symptom we have to eliminate from the totality. You will get lots of cases where you find that the patient comes in today's scenario, he comes and tells you that he has headache, he has body ache, there is weakness, pain in the throat, slight fever, and then we start prescribing on symptoms like we have remedies. First we think about arsenic or China horse or other remedies. But whenever you are prescribing an acute case, it is very important to understand what is the most defining feature of that constitution. What is the body trying to tell us? That is a very, very important symptom that everybody has to understand in order to prescribe. This is a case where it was a doctor's child and he gave me a call. His wife gave me a call that, sir, my son is having fever. The fever was 102. There was pain in the throat on deglutition, and he could not swallow water also. There was headache, especially in the temples. Fever was there. There was a lot of weakness. And there was a lot of pain in the body. Good afternoon, Dr. Meera. And she told that we have decided to give her antibiotics, but we want to give 1 dose of the homeopathic medicine because we know that if the medicine is right, the fever will subside very easily and the patient will come back to normal. They had already called for antibiotics, that is clavulanic acid and augmentin with paracetamol, Meptal SOS for fever, and Pentop D as an antacid. Welcome Dr. Palak, Dr. Prashant. So this was the case. And I asked the doctor's wife that how is the child looking? And she told me that he's appearing absolutely red, absolutely red. So whenever there is this symptom is that the patient appears absolutely red, don't jump onto belladonna because belladonna has the redness, belladonna has the pain in the temples, belladonna has the pain in the throat. But we have to differentiate how is the redness. I just asked how is the redness, and the doctor's wife told it is not threatening red, it is like ganda red, it is dirty red. So I prescribed the patient Natramur 1m single dose. Natramur 1m single dose. After 2 hours, she called me and she told, now my son wants to eat butter chicken. Can I give her butter chicken? So this is how you have to differentiate in acute cases. Dusky red, dusky red face, difficulty in deglutition, even water is a problem of taking inside, with headache, body ache and mild fever, the dusky redness of face, always think first about nitric acid. So nitric acid 1m, within 2 hours the fever came to normal, the appetite came normal, the pain had gone and the patient was fresh. So this is a very interesting case of nitric acid which I wanted to discuss. Nitric acid is such a remedy that the patient comes in splinter in throat. Now everybody will not be able to describe what is splinter. So it is very important to know how will you differentiate nitric acid pain. And whenever you want to prescribe nitric acid, there are few symptoms which are very, very important. It is written in a Mater Medica, in throat complaint, that the patient cannot swallow even a teaspoon. Difficulty in swallowing. I hope you understood the nitric acid case. Welcome Dr. Smith, Dr. Bawa, Dr. Abhijit Dewan on Instagram. So nitric acid, the patient cannot swallow even a teaspoon of water. There is difficulty in swallowing. That is nitric acid. And there is sticking pain as from splinter, which goes to the ears. Aggravation on swallowing. So these symptoms, 2 symptoms are very, very important of nitric acid. And then of course we have tonsils which are red, swollen, uneven. The tonsils are uneven. Open the mouth of a nitric acid patient, you find one tonsils very reddish, ulcer on that, and the other tonsils smaller in size, no ulcerations. That is the tonsils of nitric acid. The tonsils are red, swollen, uneven, with small ulcers on the tonsils. This is nitric acid throat symptoms, Very, very important clinical differentiation, which I am telling you, with dusky redness of the face. Then nitric acid will work 100%. So this is how, then there is discharge from the posterior nares and the pain in the throat and the symptoms in the headache. Everything is there. But these symptoms are a very, very important clinical differentiation of nitric acid. Then as the stage progresses, you can tell the patient to open the mouth and you can see the mouth is fissured, the tongue is mapped. It is there in nitric acid, but that we get lately. These symptoms which I have told you are the important clinical symptoms which I have seen and clinically verified many times in my practice, and I've got very good results. So this is the importance of nitric acid. This is the importance of that prescription which I did, single dose nitric acid, and the patient was out. Any questions? So yeah, welcome Dr. Robbins, Dr. Vishaka. Good afternoon. This is the importance of what I call very finer differentiation of remedies that you have to understand before. Otherwise, what will happen? No, the face is not fissured. Basically, the tongue is fissured. The tongue is fissured. The nitric acid, the tongue is fissured, and there are other symptoms of nitric acid tongue, then fissured tongue, and then there are other symptoms. But today, basically, I was just trying to discuss the nitric acid case. Then the nitric acid mouth is moist, fissured, or there is mapped tongue like nitrum urub. That is also nitric acid. So I was just trying to discuss because most of us on the first prescription think about either belladonna or think about Hypersulf. Everything red is not belladonna. You have to differentiate the redness of belladonna with the redness, dusky redness of nitric acid. Or other remedy very important is Baptisia tinctoria. That remedy also has that dusky redness of face. So try to differentiate these dusky redness so the prescription is very precise. For example, very close to nitric acid throat would be difficult in sensation of plug in the throat. That is Hypersulf. Hypersulf also has the same symptom, that as if there is fishbone or splinter in the throat. The patient will sometimes not be able to differentiate those symptoms, but there is just the sensation of plug in the throat extending to the ears on yawning. That is Hypersulf. Or when swallowing, that is also Hypersulf. Yeah, Baptisia. Baptisia is a very important name, Dr. Navjot. Dusky redness of face. So I have one question on Instagram before. So thank you for sharing with us, as listening to your voice could take two patients from that suffering of food urticaria as from. Yeah, thank you so much. Thank you, Dr. Vishal, and keep sharing your experiences so that we're able to discuss this. So I was just trying to differentiate nitric acid and now Hypersulf. Most of us basically first prescribe Hypersulf because whenever the patient comes and tells you that there is irritation in the throat, pain in the throat, I like to drink warm water, the first remedy is Hypersulf. But in Hypersulf, understand, the splinter is there, but throat is there, but that extends to the ear on yawning or swallowing. There is no dusky redness of face in Hypersulf. And in Hypersulf, there is swelling of tonsils and glands of the neck. That is a very, very important symptom of Hypersulf. Don't always confuse Hypersulf with nitric acid. And in Hypersulf, one thing is there, this ulceration of the soft palate that eats away the uvula. That is Hypersulf, So there are other symptoms which basically correspond. Then we have Hypersulf, that the nose is stuffed and the smell is like old cheese. That is Hypersulf. And in Hypersulf, the patient complains of sneezing every cold wind. So this is basically differentiation of Hypersulf, nitric acid, and Baptisia. Good afternoon, Dr. Amit. Of course, if I try to tell you something about Baptisia, Baptisia is a very wonderful remedy, of course. But in Baptisia, there is some differentiation, in Baptisia. For example, if we only concentrate on throat symptoms, as I told you, the dusky redness is present in Baptisia in nitric acid. Now in Baptisia, it has a very important symptom. Whenever the patient comes and tells us that the eyelids are very heavy, he cannot open the eyelids. He has to strain to open the eyelids, and immediately, what the drug we say is gelsemium. But in Baptisia, the eyelids are so heavy, there is swelling and half closed. It's like this. It is half closed eyes. You cannot close the eyes. The eyelids are so heavy. That is Baptisia. Don't always think about gelsemium with dusky redness of face. That's a very important. If you look at the face of Baptisia, it is written in books beautifully: dusky, soddened, bestowed. This is Baptisia, and the muscles of the jaw becomes very rigid. That is a Baptisia acute symptoms. And then you have symptoms of mouth. In Baptisia, the tongue is cracked, and the tongue feels very heavy, as if it is heavily coated. And the saliva of Baptisia patient is very viscid, and the breath is very foul. That is a very important indication of Baptisia throat symptoms. Of course, you have to get lucky to have Baptisia. This heaviness of the eyelids, the half open condition of the eyelids, the rigidity of the muscles of the face, the viscid saliva, the offensive breath, and the tongue which is cracked and bleeds. Tongue feels very heavy. This is Baptisia. Try to differentiate Baptisia, nitric acid, Hypersulf, and gelsemium also. Don't always look at the heaviness of eyes and the patient is gelsemium, and you fail and you feel that homeopathy does not work. It is not like that. Gelsemium basically has that drooping eyelids, But in gelsemium, there are some symptoms which are so very important, If you look at the gelsemium patient, it is said that whenever the patient tries to protrude the tongue, there is trembling of tongue. Ask the patient to take out the tongue. This is gelsemium, that is tongue trembles while protruding. Don't always think about lachesis. Tongue trembles on protruding, or sometimes the tongue is heavy and partially paralyzed as if. And the patient can hardly speak. That is a very important symptom of gelsemium. And in gelsemium also, like nitric acid, the swallowing is difficult, but it is more difficult in nitric acid. Even a spoon of water is difficult to take in. And in gelsemium also, swallowing causes pain into the ears. Pain from the throat to the ears. These are all clinical symptoms that you have to very finely differentiate in patients. Gelsemium, Baptisia, nitric acid, and Hypersulf. Yes, Dr. Baba. Yeah, so I welcome Dr. Hiral, Dr. Farman, Dr. Vikram Rakade. Thank you. Dr. Robbins, Dr. Navjot. Everyone. I hope everybody is getting some differentiation of throat symptom, because every second day on WhatsApp, I have a lot of questions regarding throat symptoms and how to differentiate throat symptoms. I'm just telling you some symptoms which I have seen only clinically in my practice, And of course, in gelsemium, you have usually a patient gelsemium is thirstless, but sometimes it may be thirsty also, with what I have seen in my practice. So I'll immediately take one question. Dr. Tony has one question. Good afternoon, doctor. What do you use to help baby turn in utero? Baby is due now. Turn to face about 7 days ago. Now breech but facing forward. Oh, a very interesting question. Just ask one question, Dr. Tony. What was the state of the mother's mind when she felt that the baby had turned? There has to be a sudden upsurge of thought, upsurge of feeling, whatever good, whatever bad, whatever excitement or anticipation that has led the fetus to turn inside the stomach. That feeling, if you can tell me, I can give you the remedy, and I have seen in many of cases that the fetus comes back to normal. So ask this symptom, that is very important, what I have seen in my clinical practice. Dr. Navjot has joined in Instagram. Okay, welcome. I hope Dr. Tony understood. Ask that feeling, ask that question to the lady, and it will be very easy. It may be a trivial thought, a trivial feeling of anticipation or excitement or exuberance that has led the baby to turn. Okay, and if you ask, just get back to me. I'll be happy to help you, because it is very interesting, no, a very brief presentation coming to normal. In Mathematics, if you see in a practice, there are remedies like CPI is there, pulsatile is there, which is written that you can change the position of fetus. But I have never used that type of Mathematics very specific, because I always ask that feeling to the patient, and that has helped me in my practice. Sore throat, some light on skin tag with years of experience. Yeah. First of all, Dr. Vishal, I hope you understood something about sore throat, something about skin tag. Skin tag. If you ask me, also a patient comes to me, lot of warts on the neck, and the warts are soft, and I also feel, my God, now what? The patient thinks that homeopathy will cure it. But I have seen in many of cases, some warts basically are aging of skin which cannot be relieved. But then, depending on the quality of warts, whether fleshy, whether flat, whether painful, whether painless, whether horny, depending on these type of warts, you will be able to differentiate warts and the remedies. But if the patient only comes with small warts on the neck, very fleshy, you have already prescribed medicine, it is not working, then the only thing you must do is go with case taking, a constant prescription, and then it will be able to help you. Okay. A patient given treatment for infertility now, few days back, delivered a baby, a boy, after 10 years. Patient very happy and thankful. Yeah, very nice, Dr. Baba, and thanks for sharing a case. Really, treating infertility and giving a child with our homeopathy medicine, it is such a wonderful feeling for the doctor also, because we have done something very substantial in the life of that parent. It's a very beautiful feeling, and of course the parent definitely are very happy, but the doctor also feels so much excited, and our confidence becomes so high that we can treat these type of cases. Congratulations, very nice. So few symptoms. Yeah, so I was just talking something about sore throat. I hope everybody got some idea about sore throat, because otherwise what happens that every time we prescribe the same remedy, and then if it does not work, then we prescribe that remedy in high potency. Then in high potency, automatically, then it does not work, and everything goes to abnormality. Oh, very nice, Dr. Noel. So whenever you are curing a very syphilitic case or very interesting case, the patient feels that this doctor has got some formula, and it will help in all cases. But it is not so. A homeopathy doctor has to always take a new case, a new history, and that's very interesting. Very nice, Dr. Baba. So one question: how to find rubric for lack of self-care? Patient has lost hope and doesn't care about appearance or what to eat or what to exercise. Yeah. So, Dr. Robbins, a simple rubric you have to take, which has generalized lot of remedies in it, and that simple rubric that you have to take is indifference. Indifference. I had a case today only, a beautiful case where the patient, my assistant doctors took the case, they took the case beautifully. And interestingly, when I asked the patient, just hear me out, I asked the patient that why are you living for? He said, I don't have any desire to live. I get up in the morning, I make breakfast for my family, then I wash my clothes, then I make lunch, then my children's come, I make them teach, then I make my dinner and go to sleep. There is no amusement in life, there is no happiness in life, and everybody keeps telling me do this, do this, do this, but because I cannot answer, people are off me. I just took one or two rubric. One rubric was anger on herself and others, and second, nothing causes amusement. Nothing causes amusement. A one step ahead symptom than indifference, and the only remedy, if you see in your Mathematica, is sepia. So this is how you have to just go one step forward than indifference, that nothing amuses the patient, sepia, or there is a delusion as if she is unfit for business, that is sepia, or the patient is angry on herself also and on others also, because others keep nagging her and she cannot answer. The only other, these three symptoms of indifference may be implied symptoms, all symptoms cover in one remedy, and that is sepia. So I just prescribe sepia with this symptom, indifference. Okay. Yes. So I was just telling you something about Mater Medica, and immediately one drug that comes to my mind, that everybody comes and asks me, sir, whenever you get remedy, first we have to prescribe ferrum first because it is for first degree of inflammation. Now, whenever you want to prescribe ferrum first, I've seen in lots many of cases the mouth of ferrum first is mostly hot. The mouth of ferrum first is mostly hot. Ferrum first also has the same symptoms of hypersulf, that pain in the throat aggravated by empty swallowing. In nitric acid, even a spoon of water is painful. In hypersulf, drinking is painful. But in ferrum first, pain is aggravated empty swallowing. That's a very, very important symptom of ferrum first, and hot mouth. And the tonsils are red and swollen. That is ferrum first. We have a question of family with von Hippel-Ledoux. They have multiple cyst and hemoglobastoma, tumors in critical site like eyes, brain, spine. The problem, there are no enough symptoms just discovered by MRI. Yeah, Dr. Maha. Whenever you should find that the patient is suffering from such a syphilitic disease, in case taking you will have very, very few symptoms. But we cannot say that we did not get any symptom, because in treating these type of syphilitic cases, you must have at least 1-2 syphilitic symptom that would enter the case. If you cannot get symptom wise, just look at the patient, look at his eyes, look at his hairs, look at his skin. These are non-verbal communication which you have to ask to the patient. Just ask her, what does she like to eat, what does she not like to eat, how does she sleep, on the left side or the right side or the abdomen or the back. Anything which is basically non-verbal communication you have to ask, because in these cases don't have time. We cannot prescribe blindly because the patient is suffering from such a syphilitic disease. Give me at least 1 or 2 symptoms, or at least take the case. If you cannot get the case, take this non-verbal symptoms and you will definitely get some symptoms to enter the case. Yeah, so I've just answered the question. Hello, sir. Very, very good case of nitric acid. Thank you for sharing. Yes, Dr. Sharon always wanted to share, these type of cases, because young homeopaths basically have some fixed ideas about prescription, but finer differentiation of remedies are so important in order to understand that case. That's important. Remedy for first stage impetigo with no itching, but wound keeps getting bigger. Better by movement from begin outside. You see, basically, if you ask me symptoms of impetigo, I basically have not seen stages of impetigo. Basically, I don't prescribe on those symptoms. But in impetigo, there are some remedies which are very, very important that I have seen in my practice. From which I would say the first remedy, yeah, Dr. Seva, welcome on Instagram. The first remedy that everybody should understand, that is sulfur. But of course, if you say sulfur, then sulfur has each and every symptom of impetigo. But there are certain remedies which I have found very useful, certain remedies found very useful in case of impetigo. And if you have seen a very rare remedy I have seen in my practice, Aurum triphyllum. Aurum triphyllum, such a wonderful remedy. Basically, we have seen those remedies in cases where of coryza and cough, but a very, very interesting remedy for impetigo. One remedy, again very rare but very important for impetigo, is entim tart. You might have never ever thought that entim tart is such a beautiful remedy, but it has such a beautiful differentiating feature, for that you'll be surprised that impetigo can be cured with entim tart. Third remedy, that is a very common remedy that everybody knows, that is petroleum. If you have ever seen the scarf for petroleum has a very, very interesting symptom, that the head is very sensitive as of cold breeze. The patient says that I feel as if cold breeze is blowing on the scalp, and the scalp is very sore to touch, which is followed by numbness. Such is an important symptom of petroleum. This numbness is very important, The head feels numb as if made of wood. The occiput is heavy and the patient feels as if it is made of lead. This numbness of petroleum is very important. And then, of course, the moist eruptions on the scalp, which are worse behind the back and the ears. So these are the very, very important symptoms of petroleum, which I have seen in my practice. So these remedies, of course, Antium tart, Aurum triphyllum, very, very rare remedies, but very, very interesting remedies. One remedy which I would like to share with this is Viola tricolor. Now, Viola tricolor is also a very, very interesting remedies in case of impetigo. Because if you see in impetigo, in Viola tricolor, it's eczema of the scalp and the glands are swollen and the face is hot and the patient has a lot of sweating after eating. This is Viola tricolor. Yeah, just a minute. This small wound is like crater. The sides are higher and the base of the wound is lower. Yeah, so if you have got a very typical case and a very typical symptom in relation to impetigo. So if we get these type of symptom, you can write some of the remedies which are very, very important in your symptom, like a crater. The remedy is phosphorus. Second, you must think about a very interesting remedy, causticum. And third remedy is natrum, where ulcers are there, deep craters are there, and the base is small. And of course, don't forget the very important remedy, and that is Merxol. If you have ever seen Merxol in your practice, Merxol has basically, if you see Merxol Mater Medica in any Mater Medica, it covers the major symptoms of impetigo. For example, if you open Merxol head, in Merxol, in Merxol, there is lot of discharge from the scalp. There is lot of discharge from the scalp. The hairs stick together like miserinum, and because of that, the discharge is very fitted, and there is lot of burning, and there is lot of stinging pain, and because of there is loss of hair with ulcers and craters on the scalp. It is written exostosis. And the sweat on the head is very oily. That is Merxol. So these are few remedies which I can think over immediately for impetigo, and I think this is sufficient for impetigo, because there are, of course, there are other remedies where you can think about. Welcome, doctor. Sorry, I can't name it. It is written in code words. There are other remedies for impetigo, like we have basilinum, we have natramur, we have carbon sulf. These are also remedies for impetigo, but in your case, whatever symptoms you told, natramur, mercury, phosphorus and causticum suits the best. या मिश्रा जी, गुड आफ्टरनून. आप बहुत लेट ज्वाइन किए, 3:30 बजे खत्म होने के टाइम पे. Yeah, very few symptoms do. Of course, don't miss arsenic and rustox also, Dr. Robbins. So let us go further. One question from Dr. Bawa is a remedy for fallopian tube blockage. See, whenever you are prescribing for fallopian tube blockage, basically that fallopian tube is blocked and there is stricture inside. So you can think of some remedies which I have used frequently in my practice: medorinum, thuja, cilicia, and thiosinaminium. If you have ever read medorinum, if you read medorinum from Allen's keynote, it contains most of the disease of the pelvic area. For example, if you open medorinum, it is written it is a very, very good remedy for salpingitis, for ovaritis, for most of the complaints of the female server. So in this case, medorinum becomes a very, very important remedy for these type of complaints. So whatever my experiences which I have told you, think about thuja, think about medorinum, think about thiosinaminium. These are remedies which are frequently used, and you also can use this remedy in your practice. Read medorinum from Allen's keynote. It contains most of the symptoms which are there in female diseases like ovaries, uterus, fallopian tubes, everything, breast, everything is there. In the pelvic organ, it is You name the disease and medullum has it. If you see medullum, it is written for a woman with chronic overatitis, salpingitis, cellulitis, fibroids, cyst, or other growths of uterus. Even going to malignancy with or without psychotic origin. This is the importance of medullum. Okay, Dr. Seva, welcome on Instagram. Sir, how yourself manage hypertension? Yeah, for blockage. Yes, Dr. Robbins. Uh, पेड़ पौधों के लिए क्या दवाई दे सकते बताएंगे क्या? पेड़ पौधों के लिए, पेड़ पौधों के लिए जनरली मिश्रा जी हम यूज करते हैं, जो हम पेड़ पौधों के लिए दवाई यूज करते हैं, अगर पेड़ पौधे का ग्रोथ बराबर नहीं हो रहा है तो मैंने बताया था हम यूज करते हैं लेसिथिन, लेसिथिन यूज करते हैं, 5-फॉस यूज करते हैं, अल्फा अल्फा यूज करते हैं। फिर कभी कभी पेड़ पौधों के अंदर ग्रोथ बढ़ाने के लिए, जैसे बताया रेमेडी आपको, कभी कभी पेड़ पौधों में ये लग जाता है, कीड़ लग जाती है, तो मैंने बताया था हम यूज़ करते हैं एजेटेरेट इंडिका, इचनीशिया, कैलेंडुला भी यूज़ करते हैं। कभी कभी क्या होता है कि पेड़ पौधों के अंदर पत्ते जल्दी पीले पड़ना शुरू होता है, जल्दी उन लोग राइप होना शुरू करते, उस कंडीशन में हम लोग भी यूज़ करते हैं। बहुत अच्छी दवाई है जो हम यूज़ करते, दैट इज़ जिंकोबा बाइलोबा यूज़ करता हूँ मैं, जिससे बहुत अच्छे रिजल्ट्स आते हैं। सो ये प्रकार की है जो दवाइयाँ हम यूज़ करते हैं हमारे नॉर्मल घर पे, बिकॉज एज सच पेशेंट नहीं आते पेड़ पौधों की दवा के लिए, एनिमल्स के लिए काफ़ी हमारे पास लोग आते ट्रीट करने के लिए। मैनेजिंग हाइपरटेंशन. Now, hypertension, the name itself suggests, Dr. Amit, hypertension. Whenever in a patient, if you get he has become out of control emotions, out of controls career wise, in that condition where the patient's emotional level is more than normal, in those conditions ask the patient whether he is able to take out that emotions or he does not take out the emotions. Those patients I have seen who cannot take out the emotions and the pain, the anger, the sorrow, and suddenly one day you find, oh, the pressure is about 180 by 120. It is not sudden. It is because of basically bottling up of the emotions which the patient is not able to take out, has given rise to hypertension. It is the peripheral pressure exerted by the blood on the vessel wall. See, that is important for us to understand. Lecithin, yeah, lecithin बहुत अच्छी दवाई है. It's a very interesting remedy for plants also, and it definitely improves the growth of the plant, as in my practice. And regarding remedy wise, if you see in hypertension, see, there are a lot of remedies you can use for hypertension, but whatever I have seen in my practice, like remedies which basically I use in my practice are phosphorus, nitric acid, coffea, arsenic. These are very Naxomica. These are very interesting remedies which I feel the constitution prescription in hypertension will give you good results. And I have patients who are only managed with homeopathy in hypertension disorders and hypertension. They are only homeopathy medicines and they are doing very well with constitution medicines. Sometimes I have to repeat once a month or once in 15 days, and when the constitution becomes stable, I repeat once in 3 months or once in 2 months, depending on the case. The remedies which we use, basically I have told you, nitric acid, mercury, arsenic, coffea, phosphorus, sulfur, pulsatilla, naxomica, phosphoric acid. These are the common remedies which I basically prescribe, and I have got good results on that. मिश्रा जी, आई होप आप समझे थोड़ा बहुत हम बताना जो चाह रहे हैं, बहुत लिमिटेड रेमेडी हम यूज करते हैं और उससे अच्छे रिजल्ट्स आते हैं. Yes, so could we have some more questions? Yeah, LM. I also use this LM potency only. LM potency works very well, and it definitely works, it works. And one remedy which I forgot to tell you, which I have been using lots in LM potency, is veratrum viridi. When there is pain in the base of the brain, it's a very interesting remedy, veratrum viridi. And if you study your polychrist remedies, every day you can get some symptoms, some unusual symptoms of the polycust remedy which you never thought were there in that. But as I told you, delusion, unfit for business, sepia, cannot have any amusement, sepia. Yeah, veratrum viridi for hypertension. Yes, it's a very very interesting remedy. And if you see veratrum viridi in simple, in simple Allen's keynote, also it is written beautifully. Uh, it is like congestion, especially in the base of the brain. Whenever there is congestion in the base of the brain and the patient is a plethoric person, for full-blooded plethoric person, violent pain with inflammation, that is basically veratrum viridi, and that's a fantastic remedy, veratrum viridi. Yeah, and very important three marking symptoms of veratrum viridi is, tongue is whitish or yellowish with red streak in the middle. The tongue has a red streak in the middle, that is veratrum viridi. It is dry, moist, that's veratrum viridi. And if you see the pulse of veratrum viridi, it suddenly increases and gradually decreases below normal. That is a very important symptom of veratrum viridi. This is I have seen in my practice in case of hypertension. Dr. Sapnil, Salam alaikum salam. Hope you are doing well. Can you throw some light and notes about this preparation potency? Yeah. COVID-19 notes basically is prepared in my factory. We got my brother is preparing that. We have got that we got that COVID-19 substance from the pathology lab, and he has made it very. So it's working well. Also, you must have seen that there are a lot of doctors which have sent COVID-19 vaccine notes, and it is working very well. And it is prepared according to the Indian the pharmacopoeia which is given. So it's not a secret. It's the procurement of the COVID-19 is important, and that we procured from pathology lab. Yes. So this was something about veratrum viridi. It's a very interesting remedy, and I've used that and have got very good results in case of hypertension. In fact, in case of migraine also, when the patient has lot of severe migraine, lot of congestion, lot of throbbing, lot of congestive headaches and all, especially on the occiput, veratrum viridi works fantastically, especially in LM potency. In acute phases, I have repeated veratrum viridi in repetition every 15 minutes, 20 minutes, 3 or 4 doses. It works wonderfully. In fact, if you give that LM potency in your chamber also, and ask the patient to wait outside, within about half an hour the headache will go and automatically the pressure will come down. It is such a fantastic remedy. Remedies for sore feet from too much walking. Yeah, arnica you can use. It's an interesting remedy, where the foot becomes sore on walking. You can use that remedy. You can simply use the word exertion, and whenever there's exertion, the first remedy that you should think about is, of course, arnica. Of course, now if you see there can be lots and lots of remedies, but basically don't try to think more simple. I think soreness should be taken care. The arnica should take care of that soreness. Of course, if you don't get the results, then there are other remedies. We have bruised pain, because in spots, like we have arnica, then we have ruta, then we have belispa, other remedies. But arnica should take care of that. We have other chronic and terminal disease to think more, rather than treating this, or just tell the patient to take rest, dip the feet in hot water, and he'll feel better. So treatment for anal prolapse when podophylla ignitia muriatic acid fails. So basically what happens, the most of the remedies have failed. Now what happens in case of prolapse? Don't, if surprisingly, this remedy should not fail. If these remedies have failed, make sure that you prescribe an antipsychotic intercurrent remedy, medorinum or thuja. I have seen that sometimes the remedy is right, but you have not tried to open the block, or you have not tried to go to the case deeper. Just prescribing podophyllum would be okay. If it works, it works. It does not work, then prescribe. Think of antipsychotic remedies. Think of thuja. Think of medorinum. Think of thiocyanaminium. Think of mercury. These remedies basically are used in intercurrent or sometimes as a constitutional remedy also. Because see, whenever there is prolapse, there are so many remedies. There are so many remedies. Of these remedies, I have seen Podophyllum XYZ very good, but you can think about Nux vomica, you can think about Carbovage. Then you have to think when does the prolapse occur? During stools, before stools, after stools. For example, if there is prolapse during stools, think about Ratania, think about Calcarea fos, think about Lachesis, think about ammonium carb. If there is prolapse after stools, then think about fluoric acid. Sometimes, while urination, there is prolapse. Then think about Bratacarb, Bratamur, Kalicarb. So these are general remedies, when you have to think about prolapse. Welcome, Dr. Shah. So I hope today's we have just completed our time for our YouTube live. It's already 3:40 and I have to go somewhere. So thank you for joining everybody, and meet you on next Saturday for again an interesting session of YouTube live and Instagram live. Thank you so much.